Hello guys, welcome to my channel. In this video we will be discussing about the ligaments of the knee joint, particularly the fibrous capsule, and that too particularly the openings in the fibrous capsule. So first let me point out, then we will be looking into that briefly. So one of the gap leads into the suprapatellar bursa. The next one is the gap between the fibrous capsule and the lateral condyle of the tibia. As I already mentioned in the previous video, that gap is for the tendon of the popliteus to pass through. And sometimes there will be gaps which just communicate with the bursae deep to the medial head of the gastrocnemius and the semimembranosus muscle. So that is the gaps leading to the communication between the bursae deep to the medial head of the gastrocnemius and the semimembranosus muscle. So these are all the gaps that are related with the fibrous capsule. Let us see one by one briefly. So what you are seeing here, this green shaded one, this is the fibrous capsule. And one of the gaps related to this fibrous capsule leads into the suprapatellar bursa. So let us take a look on the suprapatellar bursa. So this is the suprapatellar bursa. So the gap related with this fibrous capsule just leads into the suprapatellar bursa. So now coming to the next gap, as I already mentioned in the previous video, there is a gap between the lateral condyle of the tibia. So here you can see this one. This portion is this green shaded portion. This is the lateral condyle of the tibia, and here you can see the fibrous capsule. This green shaded portion. This is the fibrous capsule. So there is a gap in between the fibrous capsule and the lateral condyle of the tibia, just for the popliteus muscle to pass through. So here you can see the tendon for the popliteus. So here you can see the tendon, then this is the muscle, popliteus muscle. As I already said, there lies bursae under the cover of the medial head of the gastrocnemius muscle and also the semimembranosus muscle. So here you can see the bursae under the cover of the medial head of the gastrocnemius, and this is the bursae under the cover of semimembranosus muscle. So sometimes the gap within the fibrous capsule communicates with these two bursae, that is with the medial gastrocnemius bursa and the bursa semimembranosa. So these are the openings in the fibrous capsule. So the cruciate ligaments and the menisci will be discussed in a separate video. Now coming to the relations. So anteriorly this fibrous capsule is related to the anterior bursae. So here you can see this is the subcutaneous infrapatellar bursa. Then it is also related to the ligamentum patellae. What you are seeing here, this is the ligamentum patellae, which is nothing but the extensions from the quadriceps femoris. That is the tendinous extensions which gets inserted into the tibial tuberosity via the tendon of the quadriceps femoris. So then anteriorly the fibrous capsule is also related to the patellar plexus of nerves, but the nerves are not shown in this 3D image. So now coming to the posterior relations. So posteriorly at the middle it is related to the blood vessels, that is the popliteal vessels, popliteal artery and the popliteal vein. Blood vessels and nerves are not shown in this 3D image. Then it is also related to the tibial nerve. So posteriorly, that too in the middle, this fibrous capsule is related to the popliteal artery, popliteal vein and the tibial nerve. Popliteal artery is nothing but the continuation of the femoral artery, and this divides into anterior and posterior tibial arteries. Then coming to the tibial nerve, this is a branch of the sciatic nerve. This rises from the sciatic nerve along with another nerve called the common peroneal nerve. Then posterolaterally, this fibrous capsule, this is related to the lateral head of the gastrocnemius. What you are seeing here, this is the lateral head of the gastrocnemius and also to the plantaris muscle. So I am hiding this. So here you can see the plantaris muscle. So posterolaterally, the fibrous capsule is related to the lateral head of the gastrocnemius, this one, and also the plantaris muscle. And it is also related to the common peroneal nerve, which is a branch of sciatic nerve. Then coming to the posteromedial relations of the fibrous capsule. So posteromedially, it is related to the medial head of the gastrocnemius. What you are seeing here, this is the medial head of the gastrocnemius. Then also to the semitendinosus. So here you can see the semitendinosus muscle. And also to the semimembranosus. So here you can see the semimembranosus muscle. And also to the gracilis. So this is the gracilis muscle, what you are seeing here, this one. So sometimes the popliteus is also related to the fibrous capsule at its insertion. So here you can see the insertion of the popliteus muscle. So sometimes this is also related to the fibrous capsule posteromedially. Now coming to the lateral relation of the fibrous capsule, it is related to the biceps femoris. So here you can see the short head of the biceps femoris. And here you can see the long head of the biceps femoris. And it is also related to the tendon of the popliteus muscle at its origin. So here you can see this fibrous capsule, it is also related laterally to the tendon of popliteus at its origin.